joining from Wurundjeri country here in Naarm, Melbourne. I'd like to begin by acknowledging the traditional custodians of the unceded lands on which we live and work, and pay my respects to elders past and present. I also extend that respect to any Aboriginal and Torres Strait Islander people joining us today. Living here in Melbourne, I'm especially grateful for having access to local rivers and surrounding parklands, where I often reset and reflect to support my own well-being. I'm reminded that these places have long been spaces of care, connection, and belonging, values that continue to guide the work we are here to discuss today. If you'd like to acknowledge the country you're joining from, please feel free to share in the chat to see the different parts of Australia we're connecting from. Before we begin, just a few housekeeping notes. Today's session will be recorded, and the recording will be available on the ARACY website shortly. Please use the chat to share your reflections or questions throughout the session. We'll return to them in our Q&A portion later on in the call. And as always, make yourself comfortable, stretch, grab a drink, whatever helps you stay present. Today's webinar marks the culmination of ARACY's 3-year collaboration with the New South Wales Government and under the Investment Approach for Social Impact Strategy. More than 1,800 practitioners and leaders across Southwest Sydney have completed the Common Approach training, building a shared, strengths-based language for supporting children, young people, and families. Together, we'll explore the project background and introduction to the Common Approach. We'll look at practitioner and family experiences of the Common Approach, as well as lessons learned, followed by a Q&A session. We're joined by 4 incredible panelists who've embedded and even experienced the Common Approach in practice within their organizations and communities and families. Welcome to our panelists, including Becky Wood, who's a parent and volunteer with Village Connect and Karatani's Young Parents Program, bringing a powerful lived experience perspective. Becky has been involved with Village Connect since the first beginnings, where she has been able to access personalized support for her family, especially her son, who has accessed an occupational therapist and other opportunities she wouldn't have had without their guidance and assistance. Alongside this, Becky is studying a diploma of community services in case management and now contributes as a parent volunteer, continuing to stay involved and support other young parents. Courtney Baker joins as regional manager at Uniting, who brings over 19 years of experience across child protection, out-of-home care, and early intervention. Courtney leads teams delivering proactive, family-centered support in Southwest Sydney, building shared language and reflective practice into everyday work. Joe Ubilla joins as program lead for systems navigation at Karatani's Village Connect and is a passionate advocate for equity and systems reform. She leads a team supporting young parents and children through co-design, playgroups, and parent education, helping to make services more accessible and connected for families. Chloe O'Donnell joins as Senior Customer Success Manager at Sonder, leading Sonder's partnership in the Village Connect program. Chloe works to remove barriers to early intervention by combining digital and human care, helping families access wraparound support and the right help at the right time. Thanks again for everyone joining us today. And from ARACY, I'd like to introduce Nicole Deen, who's our lead for capacity building. Nicole and her team design and facilitate learning and collaboration opportunities that help organizations work together to improve child and youth well-being. With over 20 years experience across the community, government, and international development sectors, Nicole brings a strong focus on fostering collaboration, reflection, and inclusive practice. Thanks, Nicole, for joining us today. And now for our first agenda item, we'll hear from our partners from the New South Wales Department of Communities and Justice, Asha Richardson and Melissa Tonga. Asha is the manager of the Investment Approach for Social Impact Strategy in Southwest Sydney. She's a systems leader with experience across youth justice, forensic disability, homelessness, mental health, and early intervention portfolios in both Australia and the UK. Asha's passionate about co-design, human-centered strategy, and culturally led systems reform that strengthens community resilience and well-being. Welcome, Asha. And Melissa Tonga is a proud Wiradjuri woman and Senior Project Officer at the Department of Community and Justice. With over 20 years of experience across government and community sectors, Melissa leads strategic work under the cross-agency investment approach. She is known for fostering trusted relationships with elders and community leaders and for driving integrated place-based solutions that empower communities. So thank you all for joining us once again. And I'll now hand over to Asha and Melissa to share some background about the investment approach for social impact strategy. Thank you.
Thanks, Sarah. Hi, everyone. It's an odd experience to be speaking to so many people and to only be able to see myself and Mel on the screen and Sarah. But thank you so much to those of you who join us today, and also to hopefully many others who will be able to watch the recording. I am on Whadjuk Noongar land in Western Australia, actually. I've been here for the past 3 years, and the 2 years prior to that, actually 7 years prior to that, was in Sydney. So we're sort of coming to you from a very blessed place where the journey began, and the authorisation environment that we received in order to work across government to get in contact with ARACY, and how we ended up partnering with them to deliver the common approach in southwestern Sydney. So I'll speak a little bit today about that with Mel, and then we'll hand over to the fabulous panellists who are the ones really doing the doing, and super excited to have Becky here as well. That's just amazing to be able to hear from her. So where it started, the journey started in 2015 with the Tune Review into out-of-home care, and the reform that was in response to that for 4 years, Their Futures Matter. And when that closed, the Auditor General sort of did a review, and the recommendations included the continuation of the investment approach in 2 locations in New South Wales. Western Sydney was the first demonstration site, and southwestern Sydney is the second demonstration site, and that's us. So we really wanted to do things differently in terms of a co-design approach. Mel is just phenomenal in terms of her, she's been a member of the southwestern Sydney community and Aboriginal community for a really long time, and is really, well connected with the Aboriginal community there. So we didn't want to take the approach of cultural adaptation to design. We wanted to have culturally led design so that it wasn't something that we then had to fit to other cultures after we designed it from the majority perspective. So I think that's something that was really unique about what we did. And we had, I think, about 5 ministers at the time who were involved. We've had a lot of changes since then. Their Futures Matter went until 2021, which is when the investment approach began. And we now have 3. So we have Education, Health and DCJ ministers. So even though Mel and I work at DCJ, that's our base, we are delivering a cross-agency piece of work, and our governance structures that Mel will look at shortly evidence that. So I think having that authorisation environment has been really important in terms of being able to take the approach that we have and the inclusion of the common approach. And the participants that we've had have been across so many different parts of the child and family sector. So I think that's probably the most important thing that we can share with you today from our perspective. We looked at data, and it always had to be data informed. What we've sort of realized is that, yes, we're looking for the greatest economic returns in the investment approach, but actually the greatest economic returns are also some of the greatest social returns too. So they identified things like working with young mums, which is why we started with initially only under 25 mums, under 25 mums, broadened that to then carers, dads, because it's not only mums out there raising pups, but the specialised practices that are required to really be accessible and engage families who might be sharing experiences in that age group. And these days we're now looking at how we can take those learnings and apply them more broadly, but we'll always want to protect, I guess, the approaches that we've learnt work really well with those families, and that's the feedback that we get from them. So the design has always been iterative in that respect. We've always listened to our Aboriginal core design group, and they've led the way with that. So we had the data that told us this is where we can get the greatest economic and social return. We then took that to the community, led with an Aboriginal core design group who were nominated by the community. It wasn't people that we chose. The Aboriginal community nominated them to be the leaders in this space. and they have been instrumental, absolutely instrumental in the design of IAFSIS. We couldn't have done it without them, and they've always been a fantastic sounding board for us as to whether or not we're getting it right. Are we staying on track? Are we doing what the community has asked us to do? And Mel will talk a little bit more about that shortly. So it's always, no, we can move on. Thanks, Mel. It's always family-led, always family-led. The family has to be at the heart of everything we're doing. If that's not the case, then we're not getting it right. So we're really trying to, and it is a consistent, we consistently have to try and manage this, because I think often in the sector and in government, there is such a strong power imbalance in, yes, you need people with decisions about money and purse strings, etc. But equally, we need to be listening to the people that know what work for them. Politicians in Parliament are not best placed to say what's going to work for someone who's an under 25's mum, feeling socially isolated, experience mental health issues, whatever is happening for that person, they need to tell us what works and what doesn't work for them. So we really want to flip the power and share that as much as we possibly can, being realistic about what that, how much power you can hand over to community, but doing that as much as we can. So we've got the family there at the centre. We've got the investment plan for New South Wales, which I won't go into now. You're welcome to read that at a later stage. We can share the link. The FAXIA data, so our research arm, FAXIA, they provided the data for us. The whole of communities. So we, with that, the Aboriginal Core Design Group, who we worked really closely with, we then took what they told us and we tested that with the whole of community to see if it was applicable across cultures. And the feedback that we had was that it was great. And so again, Mel will talk a little bit more about the culturally informed practice principles that align beautifully with the common approach. And so I guess ultimately the reason that we engaged ARACY with the common approach is because it was what the community told us they wanted us to do. So Mel, maybe I think the next slide is governance.
It is.
I'll hand over to you.
No, it's one more.
Oh, the constellation of projects, sorry. So under the IAFSIS umbrella, so we do have Village Connect, who you'll hear Joe and Courtney and Chloe speak to today, practitioners within Village Connect, and that's the integrated child and family model, which is our key test case. But it is a constellation of projects that sit under myself and Mel cross-agency. So Village Connect is our key test case, but Mel will go into the shared governance in a minute. And we've also sort of looking at the culturally informed practice principles, which I mentioned, common approach, which of course is what we're talking about today, and how those two connect. And we're taking what we've learned from the work that we've done in the hub space and connecting with the national hub network, etc., to see how we can take those principles of integration across the three services, Sonda, Karitani and Uniting, and how we can apply that across the system, because we're really mindful that we are operating in a competitive tendering environment. So you've got services competing against each other for funds, but then we're also asking them to collaborate. And so those two things don't necessarily go hand in hand. And I guess the title or the name of today's webinar is around beyond collaboration and towards integration. And I think we always hold collaboration as the gold star when actually it's not. Integration is the gold star practice, and collaboration is a great step forward. But if we can start integrating practices integrating services so that we leverage off each other's resources, that's the only way that we're going to actually integrate a service in a competitive tendering environment. So that's something that we look for solutions to and try and work as best we can with the community sector around how do we integrate services, but also respect the fact that they're operating in a competitive tendering environment to survive as a business. So I think that's over to Mel.
That's it. Thank you, Asha. So I'm Melissa Tonga, a proud Wiradjuri woman, as was introduced. And thank you, Asha, for leading in. And apologies that my screen was flicking just before. I do apologise on that. Hopefully it won't continue to flick. But going into the shared governance space that Asha was just talking about, really trying to maintain that equally shared environment of authorisation and accountability, but also making sure that we continue being person-centred, culturally led and community-driven at all time. So being a cross-agency initiative, obviously part of our governance structure is our cross-agency partners. And so we've we really tried to base everything upon the inverted health pyramid system. We didn't want to be top heavy coming down. We actually wanted to put our community at the top, put them front and centre, just like with all our diagrams. At the centre will always be people, community, and that's exactly how we've established our shared governance environment also. I won't go into the great detail of every single person. You can see who's on the screen. However, at the top, you can see our people, our way. That's the South West Sydney Aboriginal Community Consultation Group. We continue to refer to them, and we have a strong established feedback loop with the ACCG. Part of the ACCG is our Aboriginal Core Design Group. So as Asha said, when we first came on board the IAFSIS initiative back in 2021, the first thing we wanted to do was be brave and be different, because we wanted to achieve different things. And so as Asha said, the first thing we decided to do was actually lead from a cultural position, Aboriginal cultural led position, because so many times we as government, when I say we, I mean all government or people, when we create a new initiative or a project or a program or so forth, it's for a wider community. And then once we do that, we realise actually we need to make some cultural adaptations here. So we flipped the switch this time and said, actually, let's lead through a cultural lens and test that against the whole of community, really testing the notion of if we can get it right for Aboriginal people, perhaps we can get it right for all people, being that what works best for Aboriginal people potentially could work best for all people. And so that's why you see sitting at the very top, the ACCG, which includes our Aboriginal Core Design Group. And then we've also got a number of other whole of community groups, because we want to ensure that we're getting it right, not just for one cohort, but all cohorts, and that we're leading it down the right path. They continually to inform us. We bring whatever information they give us to our shared governance space, where that hopefully we've established the shared authorisation environment and that shared accountability. And so we really are very passionate about this, as you possibly can tell. From the community design phase, as I just said, you know, we're really testing that notion of what works best for Aboriginal people can in fact work best for all people. From that, we tested with the Core Design Group, well, what is it that works best for Aboriginal people? What are we testing? And one of the core members rightfully said, it's not just what we do, Mel, it's why we do it, how we do it, and how a person feels when we do it. And I was like, hang on, sister, tell me a little bit more about that. And so the reason why we do what we do as Aboriginal people is our family, our community, our mob, each other. It's not just self-driven. We're always thinking of who we are, who's around us, who's with us, and how can we support one another to collectively move forward. And so with all of our diagrams, you'll see at the centre, as I said, is the person, is the people, are the community. And then secondly, why we do it, how we do it, is through culture, with culture. It's not a secondary thing, it's everything. It's within our DNA, it's who we are, whether we are consciously thinking of our culture and why we're making decisions, or it's just, as I say, it is just naturally a part of us. And so I'll skip to the next slide. This is the SIP diagram. So as I said, in the centre are the people in the community. And so when working with families, we're saying always be person-centred, but not just person-centred, who in that person's life is important to them, and find out from them who's their mob. You know, for Aboriginal people, when we say mob, we're talking about our family, our community. When we're talking with families across all cultures, let them establish their mob, who's important to them, and then find out from them also, what's your culture? Tell me about it. Yeah, ask me about my culture. I'd love to have a yarn. When we tested this with whole of community across all cultures, any person of any culture, when you give the opportunity to have that deep and genuine yarn and be led by them and sit and listen from a space of curiosity and openness, oh my goodness, you can learn so much, and the strengths that come out. And that's what we build upon when working with families. And that's what works best for Aboriginal people, which we know can work best for all people when applied through that person-centred, culturally led approach. And so they're the culturally informed practice principles. And just for a visual aspect of the diagram, because Aboriginal people are very visual also, we're storytellers. When you drop a stone in the river, or for Aboriginal art, a lot of the time, just to step back a little bit, a lot of the time it's a bird's eye view. So when you're looking at Aboriginal art, a lot of time, not all the time, but a lot of time, you're looking down from a bird's eye view. So with this diagram, think of it that way. And when you drop a stone in a pond or a river, the ripple effect. That's the culturally informed practice principles. If you start with the person and the family, be led by them with their culture, the ripple effect is huge. You can have such a positive effect on all the persons involved in that family. And you think you might be addressing one issue, but actually through doing it this way, you're going to address many. That leads us then into the common approach. As I've said, and Asha has said multiple times, we have been completely community driven here. And so what the community told us through our co-design phase and our consultation phase was that they wanted investment that supported connections across the service system. For Aboriginal people, connections is super important. Build workforce capabilities through training and development. Services to include the voices of children and young people. Services to increase capabilities in providing holistic and strengths-based approach, and for there to be a common approach to supporting families using consistent principles and language. Now, I didn't make up these words. I actually went back to my notes from our consultation, and these are the direct words of our community. And so when we looked at this, looked at our culturally informed practice principles, looked at everything we're doing, the ARACYs, the NEST and common approach align perfectly with everything community has said and completely aligned to the culturally informed practice principles. Even look at the diagrams. You'd think we sat alongside each other to draw up our diagrams. They are very, very similar. And so the purpose, part of the investment approach for social impact strategy was to fund up to 2,000 places for training in the common approach across the service sector of southwestern Sydney. And the reason we did this, the purpose of the training, was to hopefully influence change by building that common framework and language for working with children and families across southwestern Sydney, and hopefully break down barriers and make it easier for families to access and receive services and understand what you're talking about when you're talking with them. And then the last piece of the strategy, I won't spend much time here because we've got our representatives from Village Connect, but we've also got a family member who I am so excited for her to be joining us, and really humbled that we have a family member who has built the courage and bravery to come and join us on this webinar today, which really sings the praises of everything that we're doing here in investment approach, really trying to empower our people. So Village Connects, in a very quick nutshell, is building on that integrated service system that we continue to talk about, that we're trying to achieve. We've brought together 3 service providers, Sonda, Uniting and Karatani, to provide a hybrid child and family hub, a key worker model that connects families to other wider service providers. And then we've also got Sonda that provides the 24/7 access to health, safety and wellbeing support. But I won't steal their thunder. I'll allow them to do that. And I'll hand over to Nicole now to talk more about the common approach.
Thank you so much, Mel, and thanks, Asha. I will share my screen. There we go. So thanks so much for setting the scene and the context behind the work that ARACY did with IAFSIS starting around June 2022. We delivered training to more than 1,800, I should say, people across southwestern Sydney. Anyone who is working with children and families was the criteria. So we got a real range of participants from organisations like DCJ, as well as health, education, and a whole lot of community sector organisations, of which 3 you'll hear from later in today's session. As part of the training, we'll talk a little bit more about it, but we also provided access to 2,000 places online, as well as delivering 108 online workshops as part of the blended learning model that I'll share in a little bit too. As well as the online training, we also established and implemented a community of practice for any participant who had gone through the online training in southwestern Sydney, and as part of that we delivered an online 3 online workshops, but that started out with an in-person workshop as well. And really the purpose of the community of practice was to enable peer learning and sharing across these diverse organisations that were coming together to do the training in southwestern Sydney, because we also knew that having a foundation of information and an understanding, a common understanding of practice principles and what it means to work in a common approach, and that I'll share a little bit more about later, but really coming together as a way of being able to support each other and thinking about ways that this might look within different organisations was really invaluable and a really important part of the program. So as I said, we had participants from across the sector, and that was really to Asha's point around going from beyond collaboration to integration, but really recognising that in order for people to work together and for families to experience a common experience on the other end of services, we needed to have a wide range of people who support families speaking the same language. So that's why it was a really intentional, broad outreach to a variety of participants. So for those who aren't so familiar with the Common Approach e-learning, it combines about 3.5 hours of interactive e-learning modules that are self-paced, and then once you've completed that, then we run an interactive 90-minute virtual session. And that's really around supporting practice in conversations using the Common Approach practices. As part of the training, everyone also gets a tangible resource kit that includes some posters and some prompts for, again, how do you take these kind of concepts around the Common Approach and actually put them into practice. So those visual and tangible tools have been a really useful way for people to be able to do that in practice. So you'll hear a little bit more about what the Common Approach has meant to people from the rest of our speakers later in the session. But for those who aren't so familiar with the Common Approach, I just wanted to take you through a few key concepts. So the Common Approach is a prevention-focused and flexible way of working to help everyone engage effectively with children and young people and their families about all aspects of their well-being, using a common language. And I think that's really the essential part of this, is that we all can have different views and perceptions of what wellbeing is, but using the Common Approach and the frameworks that we provide, it actually gives people a really common understanding about, well, what do we mean by wellbeing and how are we talking about the same things? So it's used across government, non-government, education, health, community, social sectors across Australia, even into Finland. So this is a really versatile and useful approach that kind of cuts across sectors, silos, and different levels as well. So it's designed to foster both effective personal practice within an organisation, can change cultures, and also to promote that greater collaboration across organisations. So the Common Approach is based on 4 interconnected practices, these being child-centred, strengths-based, working in partnership, and looking at holistic wellbeing of children and their families. And these 4 practices can manifest in anything from having direct conversations with children to how programs are set up to what internal policies and procedures are designed to support good practice in organisations. And we'll hear a little bit more about that from our speakers later. The holistic aspect of the Common Approach refers to ARACY's wellbeing framework for children and young people, the NEST, which is made up of 6 wellbeing domains. So you can find more details about each of these on our website, and including through a short animation that ARACY created with Emerging Minds to share these concepts in an accessible way. So we'll make sure that we put the link for that in the notes. But essentially this is really thinking that the wellbeing wheel, which is a visual representation of the NEST, highlights that ecological view of wellbeing, and pointing back to what Mel was saying earlier, is having the child in the centre is then that kind of ripple effect, both outwards, but also we recognise the impact that things happening in that systems level, the community level and the family level have on the child as well. So it's kind of a two-way flow. And what's really important about the nest is thinking about each of these domains of wellbeing while we have them, you know, as separate chunks on this wheel. The most important thing is to really recognise their interconnectedness and how something that's happening in one domain can have a really big impact on many others, and vice versa. And that can be both in a negative sense per se. If something isn't going well in one domain, it can have really negative ripples across the other domains, and vice versa. If we really do well in a particular domain and we focus on that, then that can have many other effects across different parts of wellbeing as well. So it's a really versatile and useful framework that many of you may have seen, but it can be used in a lot of different ways. So the common approach can be used in a whole range of ways, as I said, from personal practice through to organisational design. So we'll hear some more examples of this from our speakers, but as a start, we just wanted to give you a little intro into what it can mean. So being child-centred is really about meeting children where they're at and emphasising their unique strengths and needs rather than adopting a one-size-fits-all approach to supporting them. Working in partnership can show up both in enabling families and children to come up with their own solutions and take action, and also to strengthen that collaboration across services and supports. Being strengths-based is really about supporting families to recognise and build on their own strengths and creating safe spaces for growth, and can include embedding this kind of common approach language, strengths-based language, in both conversations and informal intake processes. And as I said, being holistic is really about focusing on understanding clients' full context, and recognising the influence of the various wellbeing domains on their life. So that's it for me as the overview, and now the beauty is going to be in really understanding what this is meaning for people who both gone through the training, so practitioners, and also families who are on the receiving end of what practitioners are doing as a result of their participation in the common approach. So we're now going to bring in our fabulous speakers from Village Connect. We've got Chloe from Sonder, we've got Courtney from Uniting, and we've got Joe from Village Connect, Karatani, and then Becky is joining Joe as well. So before we get started, I know Mel did share a little bit about Village Connect, but perhaps we'll start there because this is quite a special program within the broader Southwest Sydney IAFSIS project, and then we'll kind of go into some more specific questions. So over to you.
Excellent. Well, I'm going to kick off, and we thought we would do something a little bit special. We obviously have a beautiful background sitting behind us. This is an artwork that was commissioned for Village Connect by a local artist from Southwest Sydney. Her name is Natalie Simmons. And I thought I'd talk about what Village Connect is through the image itself. So I'm just going to share that so you can see all of the little bits. Please excuse me as well. I've taken some notes because I want to honour the artwork and how it was developed for us. So the artwork is called Nali Yanagiri, which means we will go together in Wiradjuri. Natalie met with some young parents as well as service providers initially to talk about what Village Connect was, where the name came from, and just to get a really deep understanding. It was almost like an interview process. She never does an artwork for anyone that doesn't sit right, and we lured her in and she created something really beautiful for us. So on the bottom left-hand side of the artwork, you can see some kangaroo paws that are moving towards the circle in the centre, and these represent the young parents who come along to our program. We currently, as Asher and Mel alluded to, it's been traditionally, or up to this point, young parents, but you know, the prospect of this program being successful for all parents is a reality. So parents moving towards that centre place, The colours representing the state of mind that young parents might have when they first become a young parent. There are 3 circles that you can see, or 3 meeting places, and this is really symbolic for a number of reasons. Obviously, there are 3 partners who are uniting Karitani and Sonder, but Natalie explained to us that 2 meeting places or 2 circles would often mean a partnership, but 3 is more indicative of a village. And our name, the name of Village Connect, it came about from young parents through a co-design process where the parents said, everyone says it takes a village to raise children, and I've lost my village. I don't have a village. So we have stepped in as to become part of that village, but also facilitate parents, making their own village within the program. So we work really closely together to support young parents in a lot of different ways. We have the uniting key workers who walk alongside families to help them achieve their goals. That might be anything that sits around parenting, really. The Karitani supports are providing child and family health and wellbeing supports, parent education, playgroups, etc. And then Sonder is the help in your hip pocket 24/7 for safety, health, wellbeing, looking, finding out information, connecting with somebody who might be able to help you, and a number of other functions. So that's our core work, but what we actually do is work to be better than collaboration and partnership, which we prior to this, working in a lot of partnerships with organisations outside of your own, but our goal has always been and continues to be to work as that village, so on a much deeper level than just in partnership, so we can really wrap the supports around the families. There's lots of different colours in this artwork. The purple and pink represent mothers who have passed. The white resembles or reflects past ancestral spirits. And the blues and the browns are very much about connection to country, earth, waterways, etc. The colours are really significant in showing the support to ensure young ones are looked after. And that's something that within Village Connect, we don't work just with the parents, we don't work just with the children, we work with the family unit. It's very personalised. We work at a slow pace, or whatever pace the family is ready to work at, because we understand that internal and external circumstances can really impact on any family trajectory. On the top right, the meeting place, what extends out of the meeting place, acknowledges the journey and growth of young parents, starting with the courage to actually ask for help and accept help in the first instance, the questioning around on this journey of healing and transformation, am I doing the right thing? Am I headed in the right direction? And the more solid lines leaving the artwork represent the strength of the future of the families that we support. The top left quadrant, that represents the leadership of other young parents and people with lived and living experience. It shows great strength and resilience. We involve young parent voices and parent voices in all of our decision making. We want to hear from the bottom up how we can make systems more accessible and suited to the needs of our community. It also just represents that finding of a village that we always aim for families to walk away with. And the centre, the middle meeting group, captures the story of the young bubs who, they're innocent, their spirit and purity, it's guided by spirits both past and present, but they're often very unaware of the stress and the strength it takes for parents to do their job as parents. The straight dotted lines out of the circle illustrate that they have every opportunity to be what they want to be in their future. And it's symbolic of mothers who are working towards creating a world where anything is possible. And just to wrap up this entire artwork, it has so beautifully captured the journey that many of our families are on. We had a parent who was asked by a member of parliament what benefit her children have gotten from Village Connect. And her answer was really simple. She said, they got a better mother and now my children will thrive. And I think this image really, speaks to that point.
Thank you so much, Jo, and it's amazing how much a picture can tell a story, but thank you for really bringing out the details of that, because it sets the scene for exactly what we're here to talk about today. So I'm really curious, within this context of your work within Village Connect, how have you aligned and embedded the common approach into your organisations? Can you give some examples for us?
So I think for us, the common approach has become much more than a framework. It's really about how we walk, talk, and work with our families every day. So we've used it in many different ways. So practitioners use it to guide their first conversations with families, to explore what's going well, what matters most, and what they'd like to see change. One of the key points that we've been able to embed the NEST into our family wellbeing plan, which has really been able to guide conversations with families about their hopes and dreams. So the conversations that we're having with families right from the beginning is what they hope and dream for their families, which is incredibly powerful. It shifts the conversation and the focus away from problems to possibilities. And you can really see families, really light up when they hear about a practitioner being able to have a conversation with them about their hopes and their dreams, rather than some of the things that might not be going well for their families. We've embedded the practice through supervision and in our practice framework within our teams. And I think that we continue to bring it to life every day. It's not something that we did and we put aside, and it's certainly something that we strive to bring a part of every single conversation that we're having. And that brings it to life for us. I think we've seen the difference that it's made with families when we're able to have these conversations, and then we bring this tool into supervision where we can really unpack it with our practitioners to make sure that we're aligning to the common approach and in all the interactions that we have with families, which I think has really helped us embed it. It certainly hasn't been set and forget. It's certainly been an ongoing part of our process for our program.
Thanks so much, Courtney. There's so much in there, both just about the practical, how you've been able to apply, but also what that means to truly embed and to have that as part of your everyday process. So your practitioners individually going out, but then you're actually coming and embedding this into supervision and group reflection as well. And they're just such beautiful examples of what can happen when you take that dedicated approach to implementing something. So thank you for that. Really also curious to hear from others too, like what difference that's made within your own organisations and across working, together in this collaboration as well.
Yeah, Nicole, I can take that one for us. When we initially came together as Village Connect, we came together as 3 different organisations as one integrated care hub. So it was really important for us in those early foundations, setting up the programme, that we were all speaking the same language and had the same approach when we were speaking with families, whether that be at a playgroup or with a key worker group, or if someone came through to the Saunders Support Centre. So that effort up front to ensure that us as an integrated care hub, when we were speaking with one another about generally the programme, but also what we might be doing for families, had that shared language amongst us.
Could I add some things in there, Nicole? Just to add a few things to both what Courtney and Chloe have said. So within Karitani, it has actually changed our ways of working in terms of processes. So, we don't work fast in the intake period because we have the same language, because it's more conversational when we're meeting our families, our engagement is really good. It might take longer, but we're finding that you know, that a lot of families feel judged when asking for a service, but the approach we can take in implementing just the language, just the common language, or just the conversational nature of it has actually really improved not only how we work with families, how we receive referrals, and how we support families across the consortium. So having a really trauma-informed approach to actually sharing of information and doing the work in the background that the families don't need to actually see. So it really has changed some of our processes at a systems level as well. And for us at Karitani, our outcome measures for families, we were able to integrate some of the questions for the children and for the parents into our outcome measures, particularly around culture and just the broader things that might not be captured typically when you have a health sort of lens that we in the services that we're providing. We also know that there are a lot of other services that we work in partnership with across Southwest Sydney who have done the training, which is amazing. And even our peer facilitators who go through some training to run a parent education course of ours, they have done the Common Approach training as well. So it's really been a beautiful process of connecting with people who have done the training, and people say, oh yeah, I know that one, I've done that, and this is how we use it. So the strength of that communities of practice in the beginning was great. But it definitely has spread, and that has helped. It's supported the ongoing use and implementation.
Fabulous. Thank you so much for that, Jo. And I think just picking up on those things of, you know, there is that critical mass side of things as well, both within an organisation and then across a place, particularly where you are needing to work together with others to achieve the same goals. So really, that's a really great example of what difference that can make. So now I would really love to hear from the other side. So, you know, we're investing all this time and energy into training for practitioners, but ultimately that's really in service of the experience that children and families have through interacting with those practitioners. So I would love, and I'm sure everyone would love to hear from you, Becky, about what difference has it made to be on the receiving end of services and supports that are using a common approach like this.
Yeah, no, thank you for having me today. I'm very grateful to be here, and I'm very grateful that all of you are putting in such an effort to make a difference in people's my life. So just to start, so I'm 25 now. I became a young parent at 17. I wrote down a few notes just so I don't forget. I'm very nervous. So like over the last couple of years, 7 years, I've been able to be involved in quite a few different organisations and services. But Village Connect definitely stands out, hence why I'm here today to try to bring that out to you guys, how much of an impact you've had. But a huge point of difference is definitely how I've been able to feel valued in this space. And they've put the focuses on my strengths rather than my deficits and what my family needed. So it wasn't what they thought that I would benefit from, it's what I felt I would benefit from. And I was approached with Village Connect in like a very friendly, supportive way. I never felt pressured. It was authentic. The key workers are absolutely incredible. They've made me feel so welcome, made my family feel welcome. I know my kids enjoy coming here so much and they love when I'm like, oh, we got to go in. They're like, yeah, we get to come. But like, I've never been forced into anything, and I don't feel like I'm just a number in the service. Like, I'm just not another client, I'm part of the family, and that has made a huge difference into how I interpret and how I respond to the service as well. Like, I never felt like I was being assessed. It was more of a conversation, and I'm like, hey, how are you going? What do you feel like you need? And that made me feel like so warm, so able to connect with someone. And it was all done with flexibility. So I like to call it my journey in Village Connect, because I've been in through so many of the services, luckily. But I've never been pushed or pressured. Like, it's all been on my own timeline. Even if I've said no and then call them up the next day, like, hey, actually, yes, I would like to engage in that service, or yeah, I've thought about it. There's been no judgment. I just go, okay, I'm ready now. And they're always willing and ready to help, no matter who it is. Like, I don't always know what services are available to me. Unfortunately, it is really hard, and you can Google services, but you don't actually know what they entail until you've been like access a service. But they were able to guide me through multiple paths and leave the like opportunity for me to choose which one I'd like to go down. And Village Connect has been very, very supportive of that. And not only have I benefited from this, but my children have as well. So I've got my son who is on the autistic spectrum with ADHD as well, and he has received so much support at his own pace as well. We've been able to be directed with OTs, speech therapists, even psychological specialists to try to help with me and my son, which is all something I would not have been able to access without Village Connect. Through just conversations, just, hey, what's been happening? And I've been able to go, oh, I've found this and this. And they've been able to focus on my strengths. And now I can then do that for my son. So I'm now using strength-based approaches for him and my daughter, which has been really good because I've seen them been able to blossom and really develop into their own little characters. And my daughter is now on the way to being diagnosed, in which Village Connect has been able to facilitate and walk alongside me with all of this. And I feel like there's such a partnership, and that I can just reach out whenever I need without any negative talk or anything like that. Like, I don't feel like I'm a burden to them, which in other health services, unfortunately, I have felt like that. And now I'm able to do it in my personal and professional life, which is incredible. And I'm now a peer facilitator in Karitani's Young Parent Program. So I'm able to use all of the toolboxes, I like to call it, that Village Connect has given me to now spread that to other parents and their families and try to help them navigate this tough road of parenting. But yeah, I'm very grateful.
Thank you so much, Becky. And I think on behalf of everyone kind of here today and watching later, thank you so much for sharing that, because to me, that's the embodiment of the common approach in action. And sometimes when you're delivering training, you don't always see that. And so for me, it's really beautiful to actually hear what difference this can actually make in people's lives, and the ripple effects of that. I really love your reflection on you being treated in a certain way has then encouraged and enabled you to do the same thing with your kids as well, and that you felt that that was worthwhile to pass on to your kids is amazing. So thank you so very much. Would just be keen for any final kind of thoughts or words from the others around any other kind of broader benefits that you've seen, and then any kind of advice that you might give to anyone who might be curious about, is it worthwhile doing the common approach, or how would we start, or what does it mean? Yeah, any kind of final words as we start wrapping up.
Well, we're off mute, so I'll just quickly jump in, Chloe, and I'll hand over to you. But I guess moving, for other organisations, as you said about critical mass and numbers, like groundswell, the more you talk about it, the easier it is to actually implement. And something that we worked hard on initially was to give ownership of the common approach to our frontline staff. So they actually worked on a little project of changing the way we ask questions in our intake, for example. So having something that gives ownership to the staff, I think, is really, really, really beneficial. Yeah, and as I said, just talking about it with other services, because then you know that you can communicate in the same way, and that your families are going to get a really great support using that beautiful language and in a judgment-free sort of space.
I think if I could add to that, I would say that just by starting small, and you don't have to do a complete overhaul of your intake process and outcome measures, like really starting small, and it could be as simple as displaying the NEST framework in an easy place of reference, so that when frontline staff or any other staff that interact with families, they have that as a reference point, and it can be a gentle reminder to pause, reflect, have a look at the nest, and maybe that will help form, like we've said throughout, those conversations that are strengths-based and really take into consideration the hopes and dreams of families, so that it allows for that easy sharing and listening. And finally, the flexibility of the tool. It's not a rigid tool. It's very much there to be adapted to that your service and how you deliver services to the families that you have the privilege of working with.
And absolutely, I agree with Jo and Chloe. It's incredibly flexible, and you can use it in so many different ways, whether it's in supervision, whether it's in your intake process, or whether it's measuring outcomes. And it's really just being committed to genuine partnerships and curiosity for families. And I think Becky's certainly a testament to the hard work that we put behind the scenes to try and, I guess, help families feel this when we're really embodying the framework and really trying to show the collaboration and the true integration that we try to deliver for better outcomes for our families.
Fabulous. Thank you so much, everyone. And again, you know, just highlighting what it takes to actually put this sort of thing into practice. So often it's really easy to do a training and then kind of go back to your office and forget about it. So all kudos to you, all three of your organisations, to really making this commitment and embedding it. And I think what we've all seen is what difference that can make. You know, as you say, Chloe, it doesn't have to be a whole-scale reform, but just by starting small in lots of different places, in lots of different ways, is the way to, you know, really create change on a big scale that you've really been managing to do. So Sarah, maybe will we be wrapping up? Do we have any other questions that have come through?
Yeah, we've had just 3 general questions around main enablers for the teams who've embedded common approach into their practice. There were some questions around how we collaborate more with Aboriginal community-controlled organisations to strengthen cultural safety and shared leadership, and just some questions around whether the common approach framework best introduced a client intake or later during the planning and review stages. And we do have just 3 minutes, so happy to give some time for our panelists to reflect and share any further learnings after this, but I'll just put it to the team if there's any last final key messages that speak to any of the questions.
I can jump in around the Aboriginal community controlled organisations just quickly. We are fortunate enough to have the culturally informed practice principles. We have First Nations staff on our team, but we certainly do not rely just on those staff and the guidance of people around us who are Aboriginal. Our goal is to work with these organisations in partnership, the same as how we work with individual families. And so the one great thing in having the common language is that we don't need jargon, we don't need to go in to fix things. It's very much not a fix-it model. It's how can we work together, how can we partner, how can we create that village, this beautiful village that sits behind us. And I think that is a really different way of working. It takes time, but you need to invest the time to build the trust, to build respect, and to think about the outcomes for the families at the very the heart of it all.
Lovely. Feel free to jump in. I'd love to keep chatting. It's so valuable.
I certainly think that the conversation can start right from the first conversation with the family. I don't think you need to wait to different points in time, but I think the framework, it's like we've talked about, you can use it from your first interaction with the family, and you know, it's flexible. You don't have to take it all. You can just take parts of it and start to, you know, embed that into your practice. So I think if it was me, and my advice would be start from the first moment that you're interacting with families.
Beautiful. Do you see the time ticking away? I don't want to stop, but I will just say thank you to everyone who joined us today. And you all here are wonderful speakers, Becky, Courtney, Jo, Chloe, Asha, Melissa, and Nicole, just for your depth, honesty, and the care that you've brought to this conversation. Again, a big thank you to our partners at the New South Wales Department of Communities and Justice, to all practitioners and organizations who've been part of this 3-year journey, and to our new friends here today. We look forward to staying connected. So just to tie off the session, the recording and resources will be available soon after on the ARACY website. Until then, thank you for being part of this important conversation, and we look forward to seeing you at future ARACY events. So take care and enjoy the rest of the day. Thank you, everyone.
Thanks, everyone.
Thank you, everyone, for joining.